Name is Dylan Hofmann. This is my first video of the spring DAT semester, so excited to be jumping back into things, especially in this class of manual therapy. Uh, I've gotten a good bit of exposure in manual therapy. The bulk of that really was coming from my residency training that I did a couple of years ago, and if I was going to kind of look back at how I was taught manual therapy and maybe some of the philosophy behind it, really a lot of the emphasis of the manual therapy training that I've gone through is identifying your hyper and hypomobile segments and coupling exercise to fix the hypermobile and manual therapy to correct the hypomobile. And a lot of it is based on that. So a lot of joint mobs or joint manips and really working on, all right, where are we getting some movement restrictions at and how can we help this move better? All right. So that was kind of the idea and the thought behind how I've been taught. How do I implement that in my practice? A lot of it is just like I said, and like I've learned, I look at a patient, I see what are their impairments, and do I have a manual therapy tool that I can implement that's going to be effective at treating these? And some patients are great candidates for manual therapy, and I'll do an intervention on them, and I may see awesome successes. I may do one simple intervention, some exercises, they come back the next day, and they're like, man, I'm pain free. It feels awesome. And others may not be as good of candidates, and I may choose to avoid manual therapy if that's the case, or I may choose a different technique that's more suited for those patients. And effectiveness is it's hard to say, but generally I get great results from the manual therapy, especially when I am being specific in my intervention selection. So instead of just, oh, we're gonna shotgun it and throw every manual therapy intervention I know at the patient. Instead, I'm able to say, all right, out of my toolbox, which one of these is best for the impairment that I see in front of me? And I'll apply it. And generally, 90% of the time, that's going to get some kind of effect. As far as techniques I use, like I said, I do a lot of joint mobilizations. I do some manipulations. It's really based on the patient and what I'm seeing and whether it's warranted or not. You're always going to have a patient that you're going to say, I don't know if I'm comfortable doing the manipulations. And if I'm not comfortable doing it, I'm not going to do it. And there's other patients that come in and I can spot it immediately. And I say, man, this is a great candidate for a manipulation. And so I'll go into it and I'll do those manips. I do use some soft tissue stuff as well, so I will do some soft tissue mobilization. Kind of depends on what I'm working on. Again, what I'm seeing. If the impairment that I'm seeing is a joint restriction, then we're going to work on joint mobilizations. And if the impairment I'm seeing looks to be more soft tissue related, then we're going to do that. And again, that just goes back to the intervention selection. Biggest challenges I face, I would say one of the biggest challenges is really just a challenge of how often am I getting an opportunity to use the tool. Just like anything else, you learn it, you're like, man, this is great, and then you don't really have a case that fits it, or you get out of it. And I've caught myself where I'll have a patient come in and I'm like, man, this would be a great intervention, and I'm like, ooh, I haven't done this technique since my residency. I don't know if I'm comfortable doing it on a patient. And so the biggest challenge to me is staying engaged and staying involved and up to date on it, and making sure that my hands and my thought process is sharpened. And so keeping the tools sharp, I would say, is the biggest challenge I face. And the other biggest challenge is just sometimes falling into those treatment traps where I start to treat every patient the same, and I have a select intervention that I want to jump to. Those are my biggest challenges, but overall, that's my experience with manual therapy, and I look to this class as a great chance to improve on that and improve as a practitioner.